A KELOLAND man was shocked to discover he had COVID-19 and was just as surprised when, as he claims, a Sioux Falls hospital didn't have any room for him.
As cases rise, we have heard some concerns about hospitals transferring patients due to the lack of room. But state health officials say there is no need to transfer people out of state because we still have room here in South Dakota hospitals, and they have no information about hospitals doing so.
But John Bjorkman says that's not what happened to him. KELOLAND's Brady Mallory has his story and responses from local hospitals.
John Bjorkman considers himself an active person. Right now, though, just walking across his hospital room is a big accomplishment.
It's not like me to lay around at all.
A few weeks ago, Bjorkman found out he had COVID.
I don't know, it just almost burns the side of your lung. The air part that's coming down just burns and hurts.
He went to the Avera Hospital in DeSmet, but wasn't getting any better. He says staff called a specialist in Sioux Falls about transferring him here and says he heard the doctor say this.
I heard him say, well, we have no beds here in Sioux Falls available. No beds.
Bjorkman is now in the ICU at a hospital in Marshall, Minnesota, where he got remdesivir and plasma treatments.
Well, it's pretty scary, I'll tell you that. Because if I wouldn't have got that, Brady, I don't know if I'd be here right now.
Dr. David Basil with Avera Health says, as a whole, the system is not over capacity, and that bed availability depends on the day or even the hour.
Every day, it's a complex balance between patients coming in and patients coming out. And sometimes there's an hour or two where it takes a while before that bed opens up, that we put somebody in there. So that's not at all uncommon.
Basil also points out Avera's network and bed capacity covers a lot of ground in multiple states.
So that's not an uncommon occurrence that we have a patient that would go from one side of a border to the other side of a border. It's more about what's available at that hospital as far as the level of care that can be provided there.
We also asked Sanford Health about claims local hospitals are turning away patients due to running out of beds.
No, it's not true. We're prioritizing patients based on need. We always have a feeling that people should have the best care as close to home as possible. And so we may prioritize so that if there's several locations that are sending patients to Sioux Falls, we'll maybe take the patients with the greatest need first.
Bjorkman is hopeful he'll recover soon and says he's getting great care in Minnesota. However, he's still troubled by not being able to get into a hospital bed in South Dakota.
It disappointed me a little, I'll be honest. You know, you hear the Secretary of Health talking, oh, we got 1,043 beds. 260 of them are ICU capable. Well, where are they? You know, if they're in the state of South Dakota, where are we? And what good is a bed if you can't treat the person once he gets in it?
Brady Mallory, KELOLAND News.
Dr. Wilde with Sanford Health says right now there are no discussions about pausing non-essential procedures to help free up space and staff if COVID cases continue to rise.